This is a really effective way of stretching out the glute as well as getting some pressure on these tender points. You bring your knee up towards your chest and kick straight out. Hey guys, Dr. Will here from Miami Spine and Performance. Bianca back for part 2. If you guys missed part 1, she's a corporate executive, travels a lot for work, sits at her desk, also a recreational tennis player. So what we did last time was we adjusted her, made sure that all her joints were lined up, made sure that her hips were moving well. She got some relief in her upper back. Now I'm going to show you guys how I use active release technique, which is my soft tissue tool of choice, to help open up the hips a little bit more. Adjusting is a very, very powerful therapy, but it's not everything. So most of the time I have a patient in here, we're doing other therapies as well, some kind of soft tissue work, usually some rehabilitation and things like that. So the first area that we're going to work on is going to be the gluteus medius. A lot of people get some tightness and soreness along the side and upper hip right here, kind of below your belt line. So I'm going to have Bianca straighten her leg out, and she's just going to bring it in front of her and drop it down to the table. Good. Come back. We're going to do about 4 reps here. So this is a really effective way of stretching out the glute as well as getting some pressure on these tender points right through there. Good. Bianca will tell you she can feel that, yeah?
Yeah.
Now we're going to work on the Piriformis. So I know a lot of you guys have probably heard of the Piriformis. It's a deep hip rotator. So I'm going to have her bring her knee up and rotate her hip, and we're going to open up this Piriformis. Go ahead. Good. Bring that knee a little bit lower. Rotate. Good. This is an area that's usually really, really stuck if you're seated at a desk, seated on a plane a lot. 2 more. Good. Hurts so good.
Yeah.
Last one. Good. And now slide back towards me. This is the Dr. Leahy money move here. This is the Psoas release, right? So if you're somebody who has an excessive anterior pelvic tilt, meaning that your hips are tilted forward, your stomach is sticking out a little bit, your back is arched, this is a lot of times because of tightness in the hip flexor. The hip flexor attaches to the front of the spine and actually pulls you into this position, which can lead to a lot of discomfort in the low back. So I'm going to have you slide forward a little bit. And you're going to bring your knee up towards your chest and kick straight out. Good. And again. Kick straight out. Let's do 3 more. You can also get the iliacus in there too, the other hip flexor. Good. 1 more. And good. There's the hip trifecta that I'm going to use with Bianca today. We released the gluteus medius, piriformis, and psoas. Those are 3 of the most common areas that I see people have tightness in their hips. We do the adjustment, we do the ART, we might do a little bit more, and then should be good to go for today. So thank you guys for watching. I'll see you next time.